Good morning, everyone. It's wonderful to be with you here today to provide a few opening remarks for this CASDA conference focused on the National Autism Strategy. You know, we in the Canadian autism community have much to be proud of. When I started working in the field of autism, and I'm almost embarrassed to say this, way back in 1980, I went to my colleagues at the children's hospital where I worked and I said, please send me all the kids that you know that have autism. I'd like to meet them and see them and be part of their clinical care. And my colleague said, we don't have anybody with autism in our clinical service. There wasn't a single kid at that children's hospital that had a diagnosis of autism and that I could work with. Well, things have really changed over the 4 decades, if I can believe it, since that particular time. We all know that the prevalence of autism has increased. We've brought down the age of first diagnosis. I think we can proudly say that early intervention services are provided for autistic kids across the country. There are now better services for autistic people across the lifespan. And something I'm particularly proud of is that the Canadian research community has made significant accomplishments with international impact, particularly in the area of genetics, in longitudinal follow-up studies, in baby SIBS, in neuroimaging, and in cognitive neuroscience, and a number of other ways. We have had in the past a world-class training program, and in certain parts of the country like Quebec, we still have an excellent training program for young researchers who want to get into autism research. CASDA has been created and has become a powerful advocacy voice. Autism has moved from the margins to center stage. I think this blueprint for a national autism strategy and that roadmap are really significant accomplishments also to be proud of. I particularly like one quote from the blueprint that I'd like to just read out. Building a learning network for practitioners and policymakers to build evidence and consensus on promising practices. The federal government is uniquely positioned to facilitate the sharing of evidence and best practices. I couldn't agree with that statement more. I think it's very forward-thinking, very innovative, and I absolutely agree that only the federal government can bring people together from across the country, from different provincial jurisdictions, and build this learning network so that we all have a common framework to talk about early intervention, clinical practices, and different policies. I love the idea that the autism community in Canada can be a true learning health system. This is a really interesting concept, and it refers to a kind of iterative loop that starts with what's known about best practices. It evaluates outcomes on individual children, and then modifies those practices in light of new information. What CASDA is trying to do really is to transform the Canadian autism community into a learning health system, which I think is very admirable. There are way too many differences and disparities across the country when it comes to policies and interventions and clinical practices. And these differences and disparities inevitably will lead to inequity and waste of precious resources. The one thing that I think will have a major impact would be the development and the building of a national information system on autism, which I think would be a real accomplishment. Why does this matter? Well, a learning health system needs a transparent and common information system, especially on individual outcomes on autistic people. We need valid and reliable data on treatment outcomes. These are key to improving the quality of routine care. The issue is that data gaps and inconsistencies limit the potential for comparing different care models, for comparing policies, for identifying best practices, and for informing quality improvement. And in particular, what's really important is that we need to know what outcomes matter most to autistic people, to service providers, to families, in order to provide value-based and person-centered outcomes. I think we have much to be proud of, but I really think there's much still to be accomplished. This blueprint and this roadmap are significant documents in the history of autism advocacy in Canada, and if implemented, and it really needs the federal government to put its shoulder behind it, it'll have a significant impact. But if we want to compare different care models, identify best practices, and inform quality improvement, we need to bring the community together, especially autistic people and their families, and agree on this common information system that is open and transparent and developmentally sensitive across the lifespan. Thank you very much for the opportunity to say these opening words, and I wish everybody a wonderful conference.